We acknowledge that we are on Treaty 6 territory, the gathering grounds of many diverse First Nations, Métis, and Inuit peoples whose footsteps have marked this land and whose presence continues to enrich our vibrant community. Hello and welcome back to Research Recasted, the Knowledge Mobilization podcast. I'm your host, Kelsey Johnston, and today we are joined by Mona Haimour. Mona Haimour is an assistant professor in the Department of Integrated Nursing Systems at the Faculty of Nursing at MacEwan University. She also serves on the International Council of Nurses as a certified global nurse consultant. Her areas of specialization are on global and public health, with a focus on sustainability, climate change, health equity, and innovation. She identifies herself as an emerging researcher with a passion for climate change and health and climate education. Thank you so much for joining us today, Mona.
Thanks for having me.
Of course. So you are a part of the Faculty of Nursing here at MacEwan, but your research is heavily focused on the climate crisis. And I was wondering if we could start by just having you kind of explain how those two connect for you.
I would start by saying, nursing is all about health, and the current state of climate crisis and how wicked is that problem actually is making it really an argument for health and for climate action. And it was stated by the World Health Organization last year that we really need to act faster because it is making us sick, the climate change, and the intensity and frequency of climate crisis actually should be a priority for all stakeholders in the healthcare system and also outside the healthcare system. So relating it to nursing is not something new because nursing as a discipline and also as a practice focusing on the environment of the patient where, whether it's the home environment or the hospital environment or the community environment or the society environment. So it's not a new thing to nursing, but the intensity and the frequency of the climate change and all those changes in the climate-related events, whether we're talking about wildfires or we're talking about air pollution or flooding or other kind of crises, actually becoming kind of focus for us to decide on what can we do about it as nursing. You know what I mean? Like that connection between we're expanding our focus as a nursing discipline and nursing education and research to move beyond just the environments that we have always dealt with to something bigger. And we are big stakeholders if it comes to climate crisis. So we're part of, addressing it. We're part of the solution. We're part of teaching it. We're part of investigating it and being also at the table with other stakeholders and other disciplines to address really this priority kind of global issue.
Yeah, you said it's not new, but I don't think a lot of people realize that with the climate crisis, the rising temperatures, we get the wildfire smoke, which is affecting, air quality, right? Air pollution from cars and all of that. I don't think a lot of people quite realize how it really affects our health. So what originally drew you to this line of work? Like what inspired you to look at being in the Faculty of Nursing, to look at the climate crisis through this health lens?
Yeah, that's a good question, Kelsey. So, I'm an international educated nurse. I grew up in a different region, so much known for war and crisis and, climate instability and also political instability. So I saw the impact of those, violence kind of act, whether we're talking about environmental or whether we're talking about human-driven kind of violence on the health of population. So I worked also in different kind of settings, whether community fragile settings. I worked with refugee kind of population in camps and back home, and also worked in different settings where there were like kind of advanced nursing practice driven by technology. So I got experience pretty much around the continuum all the way from, times and places where you work directly on the ground, you don't have much resources, you have to support those population, you have to be the first kind of responder, but at the same time, you move between other places and you just start working in different sector and you see the technology and how it advances people's health. So I think those kind of experiences shape my kind of interest. Maybe they were hidden somewhere in my thing, but also my grad school has focused much on global health. So I driven my attention more to sustainability and how we can use it as a lens to enhance population health, address health inequities, inequalities, whether at local level, global level. So I think it's a combination of more than one thing. It's my education. It's my nursing practice way back, long time ago, but also transitioning to Canada over 19 years ago now. And starting with MacEwan, here since I joined the Faculty of Nursing. So that kind of like mixed experiences enhance my kind of like thinking about what is it that matter to me and what is it I want to teach every day and what is it that, should look like in the curriculum. Of course, those things driven by those passion that I had over the decades of practice and teaching, but still we know there is strong evidence around how priority are those things for nursing students to learn in classroom, to acknowledge and address in clinical settings. So I think it's a combination of many things. So, yeah, I hope I answered your question.
Yeah, no, you did for sure. But I wanna touch on something that you were talking about, and you said that it's your passion that you bring to the classroom with your new nursing students, and you're currently working on research about fostering a critical consciousness about climate change in undergraduate students. Yeah. So kind of focusing on documentary films that have been made about it. And I was wondering if you could just kind of talk us through a little bit about that project.
Yeah. Thanks, Kelsey. Part of my research program is SOLL, which is Scholarship of Teaching and Learning. And why I was so much attracted to that program of study is because actually classroom has always been my space to innovate, to bring my experiences, to share international kind of experiences with the student, but also bring Canadian perspective to their learning, learn from them. So it was my space always to innovate, experiment, change, the focus of the courses, but keeping it within, of course, what they should learn and the year outcomes and that kind of like program competencies. So when I decided to really build my research program, and I have to admit here, I am an emerging scholar. I really invested much in my education and in my teaching, but then I said, you know what? It's about time to do more. So I started developing that kind of interest and doing more research. I got a little bit slow in terms of prioritizing it versus doing other kind of administrative roles. So in other words, when I reached the point where can I start, I found SOLL is my space. So back to your question, Kelsey. And I'm like, okay, I introduced climate change through my courses in a very, very kind of strategic way where I aligned it to the course outcomes. I made it kind of relevant to the student experiences, but also relevant to the time where, we're living and we're experiencing the impact of climate change every day. Like we're teaching climate change as a component of the course in terms of content, climate literacy, and all those essential concepts that relate to population health, which is the focus of the course. So the course number and title is HLST 354, Healthy Population. So I integrated that content within the course, but then I wanted the student to have more of that kind of awareness, but also connecting it with the topic because of maybe my passion, could be my bias, but also it is because it is a priority, and we have really to be upfront about it and invest in student education. So I found a medium to facilitate that kind of learning beyond just having class or 2 classes on climate change and environmental health. So part of it was to introduce a climate change documentary film as a way to bring a student to learn more about the topic. And I use it in the capacity of being an evaluative component. So it is a team project where students work in small teams and get assigned randomly. They choose whatever documentary film they have on the list. And just to mention, documentary films here have been reviewed by me in terms of like what is published out there, what kind of focus they're talking about, how they can be, aligned with the course focus and that kind of thing. So, of course, they have been chosen carefully, some of them within Canadian context and some global context. So once they get into, forming their teams and they chose that kind of film, they get into analyzing the film using some critical kind of pedagogy where they have to go beyond just the impact on health, which is crucial. So they look at climate issues from science. They get into disciplinary kind of publication where they try to understand what caused sea level rise, right? Or ice cap melting, or let's say flooding in some areas in the world, or why some areas are more prone to wildfires. So whatever is the focus of their film, they try to connect with those climate-related issues, and then they analyze them from interdisciplinary kind of aspects. And at the same time, they try to synthesize them within the course concepts. And that's, an essential, really, literacy skills where a student not only analyze, they need to synthesize knowledge. They need to make argument, right? How does those kind of issues we analyze align to health equity lens or align to sustainable development goals? So they start making those kind of connections. And keep in mind, at the same time, they have learned lots of those kind of foundational concepts within the course, so they're building their knowledge and capacity while they're learning about the film. So they take their time. Usually they do it at the end of the term, the final kind of analysis and synthesis. And then after that, they connect it to the frameworks like, the SDGs, Sustainable Development Goals, to come up with ways to say, this is a global perspective. This is a big picture around how we can look at those issues from the film. And then part of critical consciousness is not only the awareness that they get it through the analysis, but also that motivation. Like I wanted to see that kind of a change in their mindset as they get into those experiences. And that's part of the research study. So I'll speak about it, but I'm trying to describe the assignment here. So they get that kind of motivation. And then at the end of their paper, they recommend solutions for those climate issues that they analyze initially in the paper. And they have to come from evidence. So we keep the student grounded in research and evidence-based, but also choose between those kind of solutions. Why choose this kind of one when it's done in this region in the world, while this capacity, in some other regions in the film might not work? So it really triggered their kind of critical thinking, but also more than that, decision-making, how we can decide on those recommendations from literature to address those global issues that we address from the film or we analyze from the film. So it is a lengthy kind of assignment, but takes the student from one place to another. It's so fascinating to see that growth in their thinking and even in their writing. Some of them publish their work within the Muse program, here the journal within our university, because they did really fabulous work. And then at the end of it, they come to that critical kind of action where they talk about reflection, their experience with the film. How did they feel as a result of, dealing with those kind of issues within the film? What kind of awareness they develop? What takeaways they're going to take to their practice? So that's what that assignment is about. Now, the research study is simply, it is a mixed method kind of research study. I have 2 co-authors with me on the study, and what we're trying to assess here is the student experience with the development of that kind of critical consciousness, which is simply awareness, motivation, and action. So we have a survey that has been, adapted from some publication with permission. We got to use that survey, but also we have a qualitative component within the survey where the student can answer with their insights. So it is really exciting to see that this study is underway. And fortunately, we also got it approved for the winter kind of sections for the same course. So we will have really a set of good number of participants. So we're really, really excited about it. Student keeps saying, when the survey is coming? And I'm like, okay, we'll do it.
Amazing. When students are coming into this course, like obviously they've read a course outline and everything, and I'm assuming the course outline would state that this is what's happening.
Right.
Do you find that a lot of students coming into it, do they already have some sort of this awareness or this like critical consciousness around climate change, or is it something that really develops throughout? I know you're still doing the data collection, but what have you kind of noticed throughout the semester?
Yeah. Because I implemented this same assignment previously without having it as a research study, but now it is a research study because it got approved. So based on, I always look at that reflection section in the writing and see what kind of a change happened, what kind of views they have put on that. Most of them, they say they had a brief knowledge about the matter, but not necessarily deep enough to understand the complexity of climate crisis, the way they got it throughout the course, but also through the documentary film. Why I got back to your initial question, Kelsey, is I think one of the driving interests for me to choose documentary film as a way is that to enhance learning about climate change is there is not much mentioned about climate change, maybe nothing actually based on the lit review I did, nothing mentioned in relation to using it as a tool in teaching nursing students about it, right? Okay. About the topic. Yeah. However, it's used to enhance the public awareness about climate change in some regions in the world. So different kind of context. So back again to answering that, I think there is that shift in, student thinking around the matter. Always where my heart is to see the takeaways, they want to take it to clinical. I need to be, some of them, they say, I need to be aware of how much waste I contribute to the healthcare system. Some of them say, never been aware that women have that kind of leadership in addressing climate change. Because some films, they talk about women role, mainly indigenous women, and also some women in Africa about how they lead on addressing climate change. So that kind of like, how multifaceted is climate change, I see that in student writing. And that motivation that they want to be part of the solution. Yeah.
Wow. That's amazing. It's nice to see that people are kind of start going in without sort of any either very little or no understanding of the severity of the climate crisis. And at the end of it, they're like, I need to, make sure that I'm not being wasteful in my practice.
Yeah.
Which is, it's nice to hear. And I'm curious, why is it important specifically for the undergrad students to learn about this and to create that critical awareness of the climate crisis?
Well, we can speak another podcast on answering that, but I think the frequency and the intensity of the climate-related events and all those anthropogenic kind of like effects, planetary health, looking at what's happening in our here country as well as globally, making it, I think, more of a proactive but also responsive kind of responsibility for educators to really say, what is it we're teaching? Are we preparing students for the market to be part of those solutions? Because a lot of stakeholders are moving forward. We see, nurses at the tables. We want the student to be prepared for those conversations, to be also understanding, that I have a role. I can be part of that solution. I can challenge some political beliefs on the matter. We know climate change can be a political topic. It is a political topic. Yep. But also it brings that kind of critical connection with the aspects of the topic itself. So it's not only a health topic, which is a huge one, still it has a social and biological kind of dimensions. And the student can be part of those kind of things. So I think the intensity of the topic itself, but also preparing the student to be part of the solution. And I do that in other courses, not only in the healthy population course, even in the maternal child health course, in the seminars. So I bring those topics and link it to that particular population because we see the impact on, let's say, fetuses, the impact on pregnant people. So it gets that kind of like the climate exposure is actually affecting people more than we're aware, as you mentioned, Kelsey. Yeah. So we want the student to get the knowledge, the skills, be part of the conversation and the change, right?
Yeah. I want to ask you about these other courses because you said it's not just this one course that you're doing this project in, it's multiple ones. Yeah. And so you used to be the co-chair of the curriculum committee for the Bachelor of Science in Nursing. And you worked on looking at these curriculums and trying to change them to look through like the health and climate crisis lens. And I was wondering if you could tell me kind of how you went about doing that, kind of what were you trying to change in these curriculums when you were on, I guess, when you were co-chair of it?
Yeah. Thanks, Kelsey. Yeah, I served as a co-chair for the curriculum committee for the PSN program for 2 terms between 2021 and 2024. It was an exciting period, actually, for the larger faculty of nursing. We were embracing on reviewing our curriculum. As a result, of course, it was timely and it was really appropriate. And it was exciting with the new leadership. And we really wanted to make it more relevant, more kind of proactive, but also, connecting it with what's happening in our world. So it was a collective effort where we came together in terms of teams, building on each one's expertise and interest. Of course, my passion was always planetary health. Sustainability is a big part of my life. And along with other faculty members. So we came together and we create some sort of approach to say, yes, we want to look at the resources and what exists within, nursing reports, also World Health Organization reports, some other kind of what's happening in post-secondary education, what are priorities. So we look at all those kind of trends, priorities in those kind of markets and domains. But we still say, what are the themes that we want to capture within our new revised curriculum to shape all those new courses, or even some of the courses that we decided to keep, but give them a fresh kind of perspective. So we came up with, I would say, 5 themes to drive the entire kind of curriculum review. So part of it was planetary health and sustainable development. Of course, that captured climate crisis and some other kind of priorities. We talk about systems thinking and system innovation because you really cannot teach any of those topics nowadays without approaching it from a system thinking lens. We talk also about truth and reconciliation, calls to action. We cannot not move without, embracing that agenda. And we have a new course on Indigenous health for first-year students. It's such fascinating course. We also embraced equity, diversity, and inclusion in different contexts and leadership. So those 5 themes shaped somehow how we're going to pull them through year 1, year 2, year 3, and year 4 in the program. So we moved with leveling them. We moved with providing some kind of context. And then when we started writing the master's master course syllabus for those courses, we decided to introduce those concepts early in the program, not leaving them towards, year 3 and year 4. So the more we introduce them early, the more we bring that kind of awareness, as you asked, Kelsey.
And that makes a lot of sense to just start with it, and then they can kind of take that through the rest of their
and
degree.
And then they become more and more like, saturated in the topic, more and more understanding the depth and complexity of it. We even moved with, having a future vision for different kind of community partnerships, right? So it gets into how would you level it in the program, and we're so excited about it. And we started the implementation this year, actually, of the new curriculum. So we're so excited to see that shift in, how do we teach in classroom? What do we teach? And what would be the impact on the coming years as students progress in the program of study. So it was a teamwork, but it was exciting to see the shift in our thinking as faculty.
Yeah. And it'll be really interesting to see how, because you said it was just this year, so it'll be interesting to see how those new curriculums move forward and how they actually affect the students in the program.
Yes.
Right? I like the idea of introducing it early so that they kind of have the baseline knowledge of how to approach their career.
Start learning that language early, and talk about those contexts, but also leveling it, right? So you don't overwhelm the students, but
So it is really cool to see that you have been able to make some changes in, at least in the institution of MacEwan, with your research. And I can only imagine that this is only the starting point. What is your goal for your research in the future? Like, where are you hoping that this research and this work takes you?
Right. Well, I ask myself every day that question, Kelsey. It's like, what matters to me? What is it exciting? I get excited about things easily. I think, for me, a priority is to really build this program of research strongly and create that kind of foundation where I contribute to really climate education within undergrad kind of studies, creating that kind of connection through the Urban Wellness Institute as a member there, connecting also with other research events happening on campus to broaden my networking and learning from others, but also, get to further my work. I think the future and ultimate outcome for me is to, and it's more of, for our university as well, is to have an identity and clear voice about where do we stand as a university. Not only me as somebody passionate in the area, because I know there are lots of people also doing great work in this area here within this institution, but I think it's more about who we are in relation to this climate crisis, who we are in relation to planetary health, and how we can bring all what we do under one kind of umbrella, under one kind of maybe entity that describe what we're doing.
Well, thank you so much for joining us today, Mona.
Thanks for having me. Such a great opportunity.
Yeah,
thank you.
Well, that's all we have for today's episode of Research Recasted. If you want to support this podcast, you can visit Research Recasted on your favorite podcast platform to find new episodes every 2 weeks. Also, don't forget to check us out on Instagram at Research Recasted, where you can leave us a like, give us a follow, or send us any follow-up questions you may have from today's episode. This has been Research Recasted, the Knowledge Mobilization Podcast, brought to you by the Office of Research Services and the Faculty of Fine Arts and Communications at MacEwan University.